treatment of patient, IV fluids form an important component. The topic of discussion is related to that IV fluid half normal saline you might be seeing in the background. The terminology, it is called as half normal saline, also has 0.45 percentage saline or hypotonic saline. Why half? If we take the normal saline, which is 0.9%, the composition is exactly half. Otherwise, technically also 0.45 percentage. That means the particular gram is present in 1 liter of the fluid. Those are technical related stuff. At least for the doctors or the medicine resident, you have to aware this contains 77 milliequivalent of sodium. Similarly, chloride also 77, which is exactly half of 154, which is present in the 0.9% saline. You can see the composition clearly over there. Sodium and chloride. Add these two, you will get the osmolarity, which is again half as the normal saline, which you use frequently. So the composition is done. Coming to the clinical use, when we select this particular fluid, whenever the patient is at risk of hypernatremia, because normal body sodium ranges from 130 to 140 milliequivalent, here it is lower than the body sodium. So whenever the patient is developing hypernatremia, high sodium, or at risk of hypernatremia, if you feel the patient is going to lose more water than the sodium, this is the preferred fluid, where water along with the lower amount of sodium can be replaced. It is one of the important fluids in the treatment of hypernatremia. Higher amount of sodium in the blood might require more free water, even though it contains sodium, but it at a lesser quantity. We always use whenever there is a hypernatremic dehydration. More technically, extracellular hypernatremic dehydration can be a good description word. On the day-to-day practice, whenever the sodium is slightly rising, or in the post-operative period where patient is having more diuresis, in the sense patient is losing more water than the sodium, you can prefer this particular N/2 or half normal saline or 0.45% saline. We have seen the uses. When there is use, always there will be some adverse effect. Is there any notable adverse effect? Basically, you have to follow the patient's sodium for any electrolyte abnormality. In absolute terms, very difficult to describe. In relative terms, look at the patient pulse, volume status, and urine output. When these are in the homeostatic range, you might not continue this, as patient will start taking orally. So this fluid is for a particular time. Once the patient comes into the homeostasis range, the patient will switch to oral, or patient will be in the recoverable state. So in adventurous use of this particular fluid, as is having low sodium, yes, it can cause hyponatremia if the patient's sodium is not monitored and being given at a higher range. So what is the side effect or adverse effect? Patient can develop low sodium in the blood. That is very rare. In why? In most of the hospital or in the ICU setup, the patient will be under a keen watch. Whenever the sodium drops, the doctor usually switch to some other homeostatic fluid. So theoretically, hyponatremia is one of the complications. Since it is hypotonic, it diffuses, it might result in some kind of CNS problem if it is given inadvertently. Mostly clinical situation we might not encounter if it is watched for. So that's all. In summary, sodium content is 77 milliequivalent, chloride is 77 milliequivalent, osmolarity 154, which is half as the normal saline that we use. That's all for today. We will see you in the next video. Bye bye.